As a GP, the most important thing for me when looking at a new treatment approach is whether there are benefits for patients. In the case of STarT Back, it's very clear that patient outcomes are improved, and also there's more efficient use of resources. In particular, I was attracted by the fact that it helps me decide which patients to refer, and those that I can confidently manage myself in primary care.
I like to use the STarT Back tool as a clinician working with my colleagues. So for patients it's really easy to use the tool. It gives you a measure to actually look at and supporting your clinical decision making, both for the patient but also for your operational management.
Managers are always challenged about how to drive up clinical quality, how to be efficient, bring innovation into practice. And STarT Back ticks all of those boxes. It obviously drives up patient clinical outcomes. From a clinician's point of view, it drives clinical confidence and clinical decision making. And from a manager's point of view, which I can't help being, it reduces referrals. It's right place, right time, right patient, right place, right time.
I find the STarT Back tool very easy to use with patients. The tool comes in different formats, both electronic and paper-based. The key thing I would recommend is to consider how you could best use it within your own normal consultation. The treatment packages themselves, I find that patients find them very easy to understand, and it's not difficult to sell the idea to them.
From a practical point of view, it is really easy to get into clinical practice. It's a simple tool to utilise. The matched treatments make sense to clinicians and they find it easy to implement. So, from my point of view, it's an easy business case to write up. For a small amount of outlay to train your physios in the high-risk approach, you get a significant benefit across the entire health service.
I do find it easy to use, and I think it's also useful as a clinician but also in a leadership role to actually be able to identify what category the patient might fit into, so then you can look at matching the treatment to the risk group, and actually it helps you with an idea of how many patients are going to sort of fit into that category.
The STarT Back tool supports but doesn't replace my normal clinical decision making. It's important, however, to recognise that it's not just about the tool. The treatment packages themselves are very effective, and I've confidence that they will help patients. An added bonus for us has been that we've improved our working relationships with our physiotherapy colleagues as a result of using the STarT Back tool.
It doesn't replace clinical decision making, but it does support your decision. So you've got it gives you more confidence when you're, when you're assessing a patient.
It was very comprehensive. It was good to see that they were looking at all the little bits and pieces that, there were other things wrong as well that were contributing to my bad back.
In my experience, I find it really helps the patients that I see in primary care. It helps me direct them to the right treatment at the right time. Okay, it does produce cost savings, but this isn't about rationing. In fact, for those patients that I see who are at increased risk of having an ongoing back problem, they get more effective treatment. Conversely, for those patients at lower risk, I feel more able to reassure them and give them good advice which will enable them to get over their back problem.
One benefit is that it gives you a prompt into talking about perhaps worries and concerns that they may have about their back pain.
I thought, this is brilliant. This is a programme that does what it says. And I have had that opinion ever since. It was one of the best programmes I've ever been on. Simply because you got continuity, you knew who you were going to see, you knew what was going to happen and how it was going to be moved on. And you knew that at the end of it, you'd both got the same goal in mind.
Overall, I have no hesitation at all in recommending the STarT Back approach.